Moving on to our next conversation here, it's integrating use cases, merits, challenges, and insights. We're going to be highlighting benefits, challenges, and insights from real-world implementations, showcasing the path towards seamless, inclusive digital ecosystems. Let's explore how integration models allow for connecting DPGs to deliver end-user digital experiences. Our panelists for this session are Edward Duffus from OpenCRVS. I request you to join us on stage, please. Jeremi Joslin from OpenSPP and Puneet Joshi from OpenG2P. This session will be moderated by Resham Chugani from MOSIP. Thank you.
Right. Thank you, Supriya. Good afternoon, everyone. So this session, we would be focusing on integrating use cases, the merits and challenges. So before we go ahead, just taking one step back, why do we actually need to integrate and why do we need use cases? I think the objective here is to ensure seamless delivery of services and access to rights. And considering today's digital landscape, I think the key here would be to integrate systems. So having your identity platforms integrate with other platforms that exist and having an ecosystem that can drive the entire objective, right? So with that, I just wanted to set the background. And of course, in this panel, we are joined by experts from OpenCRVS. We have Edward Duffus. We have Jeremi Joslin from OpenSPP, and we have Puneet Joshi from OpenG2P. So welcome, and thank you for being here. What we'll do is, we will not keep it as a regular panel discussion. We're just trying to have a slightly different approach here. We will run through a specific use case where you're actually going to see how 4 DPGs have come together to drive delivery of a service or a benefit, right? And in this specific use case, we're looking at access to child nutrition benefits. So what we'll do is we will take you through this flow in bits, where we'll have first Edward taking you through the integration between 2 systems, and then we navigate through the use case and the flow. And then we deep dive into what are the implementation challenges or on-ground real-time situations that you face, the merits, the benefits, and the value that it brings in along the way, right? So Ed, maybe we start with you. If you could take us through the POCs and the integration that we've done, how OpenCRVS and MOSIP have integrated, and of course, along the line, to take the chain forward, we also have OpenSPP and OpenG2P, right? So if you could, I would hand over to you to take us through the journey. Yeah.
Thank you very much, Resham. And although that first slide was a slide that you couldn't read all the boxes and all the detail, of course, I think it's an important slide because it highlights actually to get at the value of this use case, accessing child nutrition benefits. We worked together for quite some time on this, but it requires the integration and collaboration of different DPGs. And in fact, a number of different interfaces and integrations all need to work. So we're going to step these through to help you see what was required. So we can come back to the next slide, thanks. Excellent. It's also still a little bit small for me to read, but I don't know what's on here. So on the top left-hand side, we're going to start with MOSIP. So the prerequisite for this process or use case to work is that the mother has already enrolled for her ID in the National ID program. So next you can see OpenCRVS. So there's this swim lane where there's certain actions which will take place within OpenCRVS. It's the digital public good for civil registration. So registration of births, deaths, marriages, and divorce. And for this particular use case, we're going to be looking at the registration of a birth. So the mother has come to a civil registration office and is declaring the birth of her child. That's the first blue box. The second blue box is, as part of that process, the operator, the civil registration operator, will be validating the ID of parents. So in the past, this used to be done with a collection of supporting documents, and it was actually quite difficult to build real trust with the parent, understanding who they really were. But of course, now with the foundational ID and the ability to use the ID system, OpenCRVS reaches out to MOSIP to authenticate the ID of the mother in this case. So that's come back. It's a positive response in this case. This is more or less a happy path through the process. So the mother's ID has been authenticating, building trust, and later on what we're going to see is that the mother and child are then going to be linked through this trust. The next thing that happens is we ask ourselves a question within OpenCRVS. Does the child require a national ID? Not in all cases, as we have discovered working with different countries. But in this particular case, a little piece of business logic runs in OpenCRVS. And in this case, the mother's a national of the country. And so, that, yes, the child should get a national ID as well. So in that point in time, before registration of the birth, OpenCRVS shares details of the birth. By this stage, the mother has provided details of the birth which has taken place, provided her own ID, and that birth record is then shared with the national ID system, which is then able to return a unique identifier, the UIN, unique identification number, or a virtual ID or tokenized form of ID is returned back to OpenCRVS. So it's the birth registration process which is triggering the generation of the unique identifier from birth. That's very important. So then with the UIN generated and returned back to OpenCRVS, the registration of the birth of the child can be completed. And now you can see the final blue box there. The mother will be issued with the certificate of birth of the child. Currently, that's often in a paper-based format. In the future, that's going to be more in the form of a verifiable credential, for example. And on that birth certificate can now be included the unique identifier from birth. So that's very important. That's going to be the UIN issued at birth, which is going to be follow that child throughout their lifetime, issued at birth through the trigger from OpenCRVS. So at that point, the birth has been registered within OpenCRVS as the civil registration system. On to the next step.
Okay. So yes, so I'm Jeremi from OpenSPP. So OpenSPP in this example is a social registry, or registre des ménages in French. But OpenSPP in general can do social registry, farmer registry, or even management information system for social protection. So in this case, basically, let's say that the family is also already registered in the social registry. We want to be able to add the child to the household so they can later on, depending on different social programs, be enrolled. So in this case, we have different ways. The family could either do self-service, so they would log in, potentially using e-signet also in this example, or they could go to a booth where people would do it on their behalf. They would be authenticated, and then they would provide the paper that OpenCRVS would have issued with the UIN and potentially later the verifiable credential that we would read. We would then take this information, so the UIN, the information about the mother, for example, and send this back for verification to OpenCRVS, would verify the information, give us some additional information, and we would be able then, if it match, so for example, if we see that, yeah, the mother is the one that is declaring the birth of the child, the father is matching also the person in the household, for example, and the information of the child is matching, so we would then be able to import it into the platform. If it doesn't match, then it could potentially go to a manual process, because we could imagine that there is no manual verification, improving the speed of the verification process if all the information is matching automatically. We know that databases are not always super clean, so they might need some time to have some manual verification. Maybe the date of birth of the parents were not totally correct in the social registry, or the name is written slightly differently. So we would start more manual process to have someone that manually validate this information and correct it. And so then up to Puneet.
Thanks, Jeremy. Good afternoon, everyone. We come to the third stage of accessing child nutrition benefits. Now, the program of child nutrition benefits actually run on the system which is on OpenG2P in this particular example. And the mother registers for the program, giving her ID and the child's ID. I suppose mother has a child ID by now, right? Now, the point is that the household information is actually in OpenSPP system. OpenG2P yet does not have that information. And if OpenG2P wants to pull the information, it has to be, the best way is to pull via the ID, right? The both systems have the ID seeded, either tokenized or non-tokenized. But for simplicity, let's say the ID is in OpenSPP. So OpenG2P, after the mother does authenticate herself on the OpenG2P system, because the ID is present, the data is pulled from OpenSPP on the household information. Now, that's where we are talking about integration, actually multi-level. One is OpenG2P integrating with ID, and OpenG2P integrating with OpenSPP. And once the information is pulled, we know that it's authentic, the ID has been used, a unique ID has been used. The mother is, the evaluation criteria is applied, enrollment criteria is applied, and the mother is enrolled for the child nutrition benefit. Now further, the disbursement of the benefit can also happen via an ID. Rather, then ID touch point can also come in the disbursement stage, right? Depending on whether you're giving cash or any other benefit. So as you can see, there are several touch points of an ID coming in this entire flow.
Yeah, thanks. Thanks, Ed, Puneet, and Jeremy. I think in the previous session, we did have a mention about how an ID drives the use case, right? And you quite nicely highlighted through the entire journey the various touch points of how the ID could be used and how it could be used as a method of verification through various channels, and then the service is being delivered. Let's get into specifics maybe a little bit. So Ed, maybe I would start with you. Based on your experience with countries in terms of implementations, could you just highlight any of the on-ground challenges that you've been facing, and how do you think it could streamline this integration process?
Yeah, super, thank you. So as I mentioned when I was presenting before, this is clearly a happy path through the process. Rather too happy, maybe, and there should be quite rightly questions from the audience about what of this case, what of that case. So I'll highlight a few of those that we've come up across. In particular, I can see our friends from PSA here. We're working with them on an OpenCRVS implementation here in the Philippines and talking about how it's going to integrate with MOSIP. Likewise in Uganda and in the Kingdom of Tonga as well. So we have some real country experience. We've come across a number of challenges with this process, which we've had to sort of overcome. Stressing the fact, as I was really glad to hear in the last session, the concept of service design being so important. So all of these challenges were discovered through ongoing discussion with the country and really at a service design level. So the first one is maybe rather obviously, maybe if you can go back to the overall slide. So super. So you can see maybe the next one. Excellent. So you can see or maybe not, the authentication step of ID. Here it mentions e-signet. So e-signet obviously has, at least currently, the drawback that you need to be online. And so many of the countries where we're working, in a rural area, for example, if authentication could only be done in an online mode, well, then how are you going to identify the mother, have her authenticated and follow through with the birth registration process? Well, it wouldn't work. And you'd have many births unregistered, which is obviously the problem we're trying to solve. So we've looked at and come up with an alternative approach, an offline approach. In fact, worked on together with the Philippines team, because here on the Phil ID, on the back of the Phil ID, you have a QR code. So the QR code is effectively read offline, which then pre-populates the form. And then when you're online, when you're processing that registration, that data can still go through an online verification process. It's not full authentication, but nonetheless, it's online verification of name, sex, date of birth, just to make sure that ID from the QR code is read correctly. So I think that's a really practical, one practical example of overcoming one of the challenges. There's a set of challenges which are to do with the order in which you're expecting things to happen. So here, the happy path, the birth is registered at birth, that you might expect is normal. And then later, the UIN is created, and then biometrics are then added, age 5, etc. But what happens if things happen in a slightly different order, which is, might be the case when you're rolling out a system and ID is already implemented, for example, or in the case of a late registration of birth. So many countries where we're working, we find that, children at birth are not having their births registered. Often it happens after a period of time, in particular when they have need for their birth certificate, either at age 5, going to primary school, or sitting a secondary school certificate. So it could be age 16, for example. So by this point in time, they may well already have enrolled for their ID. So what happens in that case? So if you follow this process through, you might expect that a duplicate UIN or a second UIN would be created for the child when they register for their birth late. So obviously we need to counter that. We've looked at different processes for doing that. Either you put in place a business process. I would argue often the business process is one of the best ways to eradicate such problems. So you could say after the age of 5, you as standard, you need to enroll for your national ID first. So therefore, you're ensuring there's always a specific order that these enrollments need to take place. Or, of course, you can do biographic deduplication, either in OpenCRVS, which is possible, or alternative within MOSIP. So we've looked at that as well. Maybe the third case, if I can, third challenge is, in cases where, as I was saying, things don't quite happen in the order you would expect. So what if parents do not have an ID yet, but you want to nonetheless register the birth of a child? So we need to ensure that that's possible because we're trying to ensure universality of birth registration. So it's another case we need to cater for. A real world example. So potentially in the short term, we might not make the parent's ID and authentication of ID a mandatory requirement for birth registration. In the short term, it may be necessary to make that optional. That could be something to look at in the short term. So yeah, in conclusion, these real world challenges that we face are often to do with the expected order of things, and also the relative rollout and speed of rollout of different systems, because there's a number of them here. And yeah, in general, by working through service design kind of methodology with a country is the best way to understand the use cases and the variety of scenarios that you need to cater for.
Yeah, thank you, Ed. So we've been discussing many of these that you mentioned, and I think we are working quite closely to address all of these challenges that you mentioned. So while it's not always just challenges, we do have such integrations do bring in a lot of value, a lot of merit, and has a lot of impact as well. So Puneet, on that note, maybe if you could highlight how these integrations have actually created an impact from an OpenG2P perspective?
Yeah. The work that we are doing in Ethiopia is a great example of both how ID enables use cases and how use cases drive the ID adoption. And that's an excellent example where the FIDA ID is being used to populate certain registries, the farmer registry, the emergency relief registry, also the destitute, urban destitute registry. So now here, the integration with ID is absolutely important because the data in the registry is only being entered if an ID is available. Or rather, if the ID is not available, the individuals are being issued the FIDA ID first, and that information is going into the registry. So registries from day one are already clean in that way. So here's an excellent case of a use case driving the adoption of ID. People are motivated to get the ID because they're going to get benefits. And this integration of ID is absolutely important here and giving great benefit in, as I mentioned, clean registry, individual records, and hopefully as when the registries even go bigger, the value of this unique entries in the registry will be quite evident because the leakages and ghost entries will be avoided. So absolutely important to have this integration with the ID at least. And with other systems, we are integrating with other systems, but of course, that's where the interoperability discussion comes in. That are the other systems ready for easy integration? And that's, of course, a challenge for all countries, and maybe we can hear some more views on interoperability.
Yeah, I think you mentioned the right word here, interoperability, and with that, I would like to move on to Jeremi. To drive the interoperability and integrations, I think one aspect that's important is having key principles and standards in place. So in this entire journey, we see a lot of data is also being transmitted, right? So the national ID data is being fetched, and then you're authenticating. So what do you think is the role of standards here? You're also working on various initiatives like DCI, right? So if you could throw some light on that, Jeremi.
Yes, thank you very much. So definitely, like, standard is really at the core of what we're doing, and we're spending a lot of time. Actually, with my colleagues also, we're standing on different standard body with Puneet, with Ed around CRVS standard, social registry standard, what else? Farmer registry, disability standard. So there is a lot of things around this. And why you should care about it is the problem is identity. You have a little bit more time usually to set it, so you have a little bit more time to solve this problem. But then when you're starting to go more to sectorial things, like you're more looking at solving a problem you have today, and so you're adopting software to solve a problem today. And you need to get value quickly, right? You cannot wait 10 years to make it happen. And the way to do this is by ensuring that the software you're adopting are implementing these standards. It's not the end of everything, right? It's not the solution to everything, but it's helping, it's making it easier to get toward interoperability. And this is why, like, all of us, we're working quite a lot on this, participating in this. And in terms of standards that we're looking at is, so OpenID Connect is one. I mean, you've seen here also sent around a lot is verifiable credentials, and you have like a specialist of verifiable credentials here. We are also working, so digital convergence initiative, where all the three of us actually are part of, around social registry, CRVS, farmer registry, disability registry. More recently, OpenSPP was like validated for GovStack also, where we are on the registry and also on the geographical information system, because also this social registry or farmer registry type of data is very important for anticipatory action response to disaster. So being able to integrate this with geographical data is very important. And like usually when you have a disaster that is about to happen, you need to have system in place so that it's ready, right? You don't have a month to solve the problem. You need to be able to use it now, today, and solve it. So this is why I think it's key, even if you don't see the need for the standard today, if you don't have the use today, I think if you have a choice between a system that has no standards employed and like a system that have some standards ready, even you don't need it, I would say like look at taking systems that have the standards, because like you most likely are going to need it later. So this is why I think it's quite important today to start with this.
Thank you. Thanks, Jeremy. So I think we have 5 minutes on the clock. Would we like to take some questions from the audience? Do we have any questions?
Hi everyone, this is Ahmad from DHIS2. So thank you so much for sharing this really interesting use case. I mean, it's quite inspirational for all of us to see how it progressed. So you explained about all the technicality related challenges in this integration. But as DPG product owners, what does it take to have this kind of integration or collaboration between the DPGs? Is it very challenging, and how other DPGs can also join this kind of effort? So if you can share some insights around the challenges in collaborations and governance, that would be also very helpful.
Okay, I can get started. And so yes, definitely. I mean, it's a lot of effort working on standards, like because we are participating in the standard committee. Standards take a lot of time, a lot of discussions, a lot of refinement, a lot of negotiation between different projects to make it happen. And then you need to implement it, which takes also a lot of time. After, there is also some project like our colleagues also, for example, they are not here, but OpenFN, for example, that can be also systems that allows to help with interoperability and helping with implementing these standards and making existing solutions communicate. But yeah.
Yeah, I'd echo the fact that it's a lot of time and effort to collaborate on this kind of stuff. We've been fortunate to have support for from the Digital Convergence Initiative, the GIZ project, that's been quite instrumental to help create some of the standards around CRVS and social protection. So it's great to see that some development organizations are specifically focused on interoperability. Yeah, I mean, just one, if I may, one other thing that I just wanted to highlight really is that this slide, seeing the 4 DPGs on there together and the interoperability between them was not initially, I think, how we conceived OpenCRVS. OpenCRVS, was a system to ensure legal identity for all, as per SDG 16.9 and universal birth registration. And it was only when we started exploring the power of the data within the civil registry and how valuable it would be, we started exploring. We had a hackathon a couple of years ago, etc., to start exploring this further. And Jeremi, Puneet, and others came along and showed the value of this data being used. So I think that's another element, Pamod, which is really helpful. The concept of hackathons, with the data to start experimenting, exploring different use cases. Yeah, I don't think at the time we had a view on accessing child nutrition benefits using the civil registry data. So that was it was a great initiative. By the way, if you want to see demonstrations of some of the integrations that we're seeing here, either videos which we've done before with OpenSPP, you can go to our stand, for example, and observe those, even see a demonstration of OpenCRVS working together with MOSIP, the latest version. Maybe Thierry, would you mind just standing up? Yeah, that's Thierry, who's going to be on our stand. He can run you through and demonstrate some of these integration use cases. We either have as videos or live demos, which Thierry's very happy to do as well. Thanks.
Thank you. Any more questions? Maybe we take one more, if we do. Yeah, we have one here.
Muito boa tarde, vou falar em português e
maybe possible. You can hand over another micro so I can help on translation. I think there's no Portuguese translation, so if possible, you can hand over another microphone so I can help with the translation.
Yeah. Or you give him a. You want another microphone to translate.
Ok, continuando, Silvestre da apresentação São Tomé e Príncipe.
Sylvester, apresentação from São Tomé e Príncipe.
É verdade que nós começamos pelo registro supondo que há uma mãe real e há bebê que nasceu dela.
We start the registration with the supposition or with the fact that there's a mother and also there's a newborn from her.
E ao falarmos da identidade, também não devemos descurar a possibilidade daqueles meninos que muitas vezes são sequestrados ainda na maternidade.
So regarding to this, there are some realities where some babies they are kidnapped just from when they are born.
É verdade que estamos a falar sobre os benefícios e a falar também sobre a interoperabilidade.
It's true that we are talking about benefits and interoperability between systems.
A minha pergunta vem no sentido de se é que há ou se é que pensaram alguma vez nessas crianças que podem ser sequestradas, tendo em conta os benefícios, porque os pais muitas vezes, os supostos pais, muitas vezes correndo atrás dos benefícios, levam as crianças da maternidade e assim, na questão da interoperabilidade dificulta-nos de seguida em conseguirmos descobrir se é real, se o filho é daquele casal ou se é daquela família.
So I'll try to resume. What he wants to know is no, it's a very it's not it's a reality in some context. Some countries still facing that because of the lack of integration between systems and maybe some registration system with some difficulties, especially the health services, to identify babies and mother or newborns and their mothers. So what you want to know is about how do you manage, for instance, on cases where they can verify that some child, they are like kidnapped at born just to be used as a person that is looking to the benefits of social protection, for instance.
Muito obrigado.
Okay, thank you.
I mean, yeah, that's a horrific use case, but obviously one which is, if it's a reality, we need to try and, cater for. I think two things which, we can discuss this afterwards as well, and we can explore this in further. I think that would be helpful. But I think what that's indicating to me is the importance of the notification of birth at the earliest possible point in time, before a kidnapping, for example, has taken place, because then you're able to use the civil registry or the births which are registered or notified, at least within the civil registry, as a potential point of flagging child protection cases. We have discussed this in the past to some extent, but the important aspect of this is that you're able to notify as soon as possible after the birth has taken place in the health facility. So either because you're using a system, your civil registration system, notifications are taking place there already at the health service level, or your health system is tracking the births within that system, and that data, another integration which we've not shown here, but is possible within OpenCRVS. The notification of birth is coming from the health system to OpenCRVS. And so if you have a notification which is then not being registered or is potentially fraudulently being registered, you might be able to then flag that later to be able to identify specific child protection cases. But we can explore that a little bit further to understand how we might do that together.
All right. Thanks for that, Ed. We're running out of time, so our panelists are available offline for any further questions that you may have. On a concluding note, I think the conversation here clearly highlights the importance of such integrations, and maybe potentially the way forward is, of course, to address challenges, Ed, that you have highlighted. Maybe also, of course, embrace the impact that it brings in, the value that it brings in, and along the way, adopt standards so it drives interoperability. So on that note, I think we'll conclude the panel, and thank you once again for being here. Thank you.